The GentleMax Pro Plus laser system requires routine care of some of its components for proper performance and reliability. Always perform user verification tests at the start of each treatment day. These verification tests include cryogen coverage and beam alignment. To ensure that the cryogen spray nozzle is properly aligned with the distance gauge, hold the handpiece perpendicular to the thermochrome ink paper and press and release the purge button to expel the cryogen. The paper should turn color in the center of the distance gauge ring. The beam alignment test will verify that the laser and aiming beam are in alignment with the distance gauge. Aim the handpiece at a white piece of paper and inspect the aiming laser beam for circular uniformity and clarity. There is a user serviceable air filter on the right side of the rear panel of the laser system. It is recommended that you clean the air filter on a monthly basis. Remove the air filter by pulling on the ring attached to the filter. Vacuum the air filter on the grill side of the filter, then reinsert it into the slot. This can also be cleaned by running water through the foam side of the filter and should air dry before reinserting the filter back into the slot. The delivery system consists of a number of components that require routine maintenance for proper system performance. The distance gauges should be cleaned when they become dirty with debris. Perform a swipe clean every 40 to 50 laser pulses by swiping a paper towel or a piece of gauze moistened with warm water across the distance gauge. Following the laser treatment, perform a full cycle clean by placing the distance gauges into a container of 1 part bleach and 9 parts water and soak overnight. Remove from the cleaning solution and scrub with a toothbrush, then rinse in clean water and allow it to air dry. The handpiece should be thoroughly cleaned after each patient is treated. Verify the laser system is in the standby state or off. Wipe the exterior surface with a gauze pad or towelette moistened with isopropyl alcohol. Periodically clean the inside of the handpiece. Daily cleaning is recommended for heavy hair removal usage. To clean inside of the handpiece, remove the window and the window holder. Remove the slider by pressing and holding the slider lock button and gently pull the slider all the way out of the handpiece. Using the long forceps supplied, wipe the inside of the tube with isopropyl alcohol. Remove the slider attachment from the slider. Wipe the slider attachment with a gauze pad moistened with isopropyl alcohol. Clean only the external facing surface of the slider attachment window. Do not remove the window for cleaning. If debris cannot be removed, replace the slider attachment window while wearing gloves. Reattach the slider into the slider by pressing and holding the slider lock button. The window can be cleaned while in the holder or gently pushed out of the holder for cleaning. This should be done every 250 pulses or sooner during long treatments, especially when utilizing fast repetition rates and short pulse durations. Wearing gloves, use a gauze or towelette moistened with isopropyl alcohol. Wipe the handpiece window dry with a lint-free lens paper or tissue. The handpiece window holder should be cleaned while the window is removed. Use a clean cloth to wipe clean the inside and outside edges of the window holder. To reinsert the handpiece window and window holder, you should hold the handpiece window by its edges and drop it into the window holder. While pointing the handpiece up, slide the window holder into the handpiece until the window holder is flush with the top of the handpiece. The handpiece fan filter should be cleaned periodically when a handpiece bubble message appears. To clean the fan filter, push down on the small clasp at the top of the handpiece fan filter cover and pull the cover off. Remove the fan filter from the cover by pulling the filter off the Velcro square. Run water through the fan filter to clean it. Let the filter air dry. Once dry, press the filter back onto the handpiece fan filter and reattach. Wipe the exterior of the laser system with a soft cloth slightly moistened with hospital-grade disinfectant, isopropyl alcohol, bleach solution, or mild soap and water. The system is cooled with deionized or distilled water. Check the water level monthly if the system is used daily, every 6 months if the system is used weekly, or if a fault code preceded by a 7 displays. To check the water level, turn the laser off and allow it to cool. The water reservoir is located at the rear panel of the laser. Turn the cap counterclockwise to remove it. Look into the reservoir and inspect the water level. It should be filled within 1/2 of 1 inch from the top of the reservoir, filled with DI or distilled water if necessary. Always handle the touchscreen with care. It is recommended that you periodically clean the glass touchscreen. Use isopropyl alcohol or a non-abrasive glass cleaner on the touchscreen. Apply the cleaner with a dampened soft cloth. Remove the DCD cover on the top of the laser system. Slightly pull the 2 retention brackets apart and pull the empty DCD canister from the system. A small amount of cryogen may release when the canister is removed. Install a new DCD canister by removing the cap and placing it into the DCD receptacle. Gently push down so that the retention brackets lightly snap into place. Replace the DCD cover. The canister can be disposed of by a waste disposal company or in the trash if it's completely emptied. Turn the venting valve completely clockwise to close the valve and attach the valve to the canister by turning clockwise onto the threaded portion of the canister. Position the canister so that the venting valve is at the top and pointed in a safe direction away from you. Open the venting valve by turning the handle completely counterclockwise and allow it to empty completely. Remove the valve from the canister by turning it counterclockwise. Store with venting valve for future use.